All right, so bone grafting. We've got a ton of listener questions and materials on this one, so
Yeah, lots to unpack.
definitely. Let's try to hit the highlights and really get into some of the details on how bone grafting works and what are
The what and the why?
the what and the why, exactly. There's some pretty interesting stuff in here.
Yeah, some cool stuff. I mean, did you realize that you lose more bone horizontally than vertically after you take a tooth out?
I did not know that.
Yeah.
And we're going to be talking about grafting materials from another species.
That's right.
Which just blows my mind. But
True oil.
yeah, so let's back up for a second and just talk about like why bone grafting, why is that necessary at all in dentistry?
Okay, so imagine you're building a house. You need a good foundation.
Okay.
So that's what bone grafting is all about. It's providing that solid base in your jaw to support, dental implants, bridges, anything that needs a good solid foundation. It's all about encouraging new bone growth where it's needed.
I see. So it's kind of like setting the stage, getting...
Get the ground ready. Yeah, it's prepping the site, making sure it's strong and healthy so that whatever we're putting in there will last.
Okay, that makes total sense. Now, you mentioned this thing about horizontal bone loss. So what is that exactly, and why does it matter so much?
Okay, so you would think, right, that after you lose a tooth, the bone just shrinks down vertically.
Right, yeah.
But it actually shrinks inwards, too. So you lose bone width.
Oh, wow.
Which is, and this is most dramatic in the first 6 months after an extraction. There's a study by Cowood and Howell that shows this. That's why, often dentists will recommend bone grafting fairly soon after extraction, to preserve as much of that bone as possible.
Oh, so it's almost like a race against the clock?
Kind of, yeah. You want to preserve what you have and rebuild what's been lost.
I see. And that's probably why there are so many ways to, I guess, categorize bone defects, right?
Exactly. Your materials mentioned different types, from dentate, where there were still teeth present, to post-extraction defects. And then there are variations like well-rounded ridge, knife edge, flat, depressed bone defects. And each one kind of describes a different shape and severity of bone loss, which helps determine the best approach for grafting.
That makes sense. So we've got all these different bone defects. Now, what about the actual grafting materials?
Yes.
This is where it gets really interesting, I think.
This is the fun part. So let's start with the gold standard, autograft.
Okay.
This is where we use bone taken from your own body.
So you're basically borrowing from yourself.
Yeah, exactly. Like common sites of the chin, back of the jaw, sometimes even the shin bone.
Wow. Okay.
Yeah. And the beauty of autograft is that it contains living cells that actively promote bone growth. It's like giving your body a jump start on healing.
That makes a lot of sense, but are there downsides to that?
Yeah, there are a couple of downsides. So first, you need an additional surgery, which means more recovery time, potential for complications, and, the amount of bone you can harvest from your own body is limited.
Of course.
So those are things to consider.
Yeah, that makes sense. But so if somebody doesn't want to have another surgery or needs more bone than they can give up, what are the alternatives?
So in those cases, we have allografts. This is bone that comes from another human donor, could be living, could be deceased. It's very carefully screened, irradiated, and stored to ensure safety.
Okay.
Examples of this are like FDBA.
Right, yeah, we saw that.
Which stands for freeze-dried bone allograft, and Botis Max graft. These are both commonly used in dentistry.
Okay, so that's human bone, but then there's my mind is still blown by this, that you can use bone from other species.
I know, right? It sounds crazy.
Tell me more about that.
It's called a xenograft. And it's more common than you might think. Typically, it's derived from bovine bone, so cow bone.
Cow bone,
yeah. It goes through a very specific processing to remove all the organic material, and what you're left with is this mineral scaffold that's very similar to human bone.
Wow.
Some brands you might have heard of are BioOs and Cerebone.
Okay, so it's not just like taking a chunk of cow bone and...
No. It's highly processed, very specific.
Like sticking it in there.
Exactly.
It's like, what did you call it?
Osteoconductive.
Osteoconductive.
Yeah, it acts like a guide or a framework for the body's own bone-building cells to come in and do their thing.
So it's almost like a blueprint then for the bone to build on.
Yeah, exactly. It provides the structure, and the body takes over from there.
That's incredible. And I see here there's another category, alloplasts. What are those all about?
Alloclasts are synthetic materials, things like hydroxyapatite, beta-TCP, calcium sulfates. They definitely have a role in bone grafting, but we'll focus on the other types today if that's okay.
Yeah, that makes sense. So we've got our bone grafting materials, but how do you use them? What keeps them in place? What helps them do their job?
Right. That's where guided bone regeneration, or GBR, comes in.
Ooh, GBR. I was hoping you'd bring that up. It sounds kind of like a game changer.
It is. It is. GBR is a technique that uses special membranes to control the healing process, enhance bone regeneration.
Okay.
It's been around for about 30 years, and, it's evolved over time.
Right.
We've moved on from simple ePTFE membranes to more sophisticated collagen membranes, composite grafts, lots of exciting developments in the field.
Wow. So these membranes, they basically act like barriers to protect the graft and guide bone growth. Is that right?
That's a great way to put it. They help to create the optimal environment for bone regeneration.
Okay, but I have heard there's some debate about whether GBR actually makes a difference, like in the long run.
Yeah, that's a good point. And it's important to acknowledge both sides. So some studies, like the systematic review by Chiapasco and Zanaboni, have shown, favorable results with GBR.
Okay.
But often these studies have limited sample sizes, and there's a lack of randomized controlled trials, which are the gold standard in research.
Right, right.
So, it's an ongoing discussion in the dental community.
So basically more research is needed to, definitively say whether it's necessary or not.
Exactly. It's hard to prove absolute necessity because we lack studies directly comparing it to situations where it's not used.
I see.
But it's a very popular technique.
Yeah.
And one that many dentists believe is beneficial.
Okay, that makes sense. Now, you've mentioned these composite grafts a couple of times. What are those exactly, and how do they work?
So a composite graft combines different materials to create a more powerful effect.
Okay.
A classic example is the 2-layer composite graft. It uses a combination of your own bone chips, the autogenous bone, and then bio-os, that bovine bone material we talked about.
So they team up to create a super graft?
I like that, yeah. The autogenous bone provides the living cells to kickstart things, while the bio-os acts as a long-term scaffold. They work together really well.
Oh, that's cool.
And the source materials also mentioned using BioGuide, which is a non-cross-linked collagen membrane. That helps contain the graft and prevent the soft tissue from interfering.
Okay.
And closing the surgical site with minimal tension is also crucial for good healing.
Got it. So it's a whole, a carefully orchestrated symphony of materials and techniques.
Exactly.
Wow. And it seems like autogenous bone plays a starring role in a lot of this. Your material really highlights its unique advantages. Can you expand on that a bit more?
Absolutely. So aside from that kickstarting growth, autogenous bone has a really favorable surface-to-volume ratio.
Okay.
Meaning there's a lot of surface area for those bone-building cells to latch onto.
I see.
And a study by Asparahova and colleagues found that autogenous bone rapidly releases growth factors, things like TGF-1 and BMP2, which really boost bone formation.
So it's kind of like the VIP of bone grafting then.
In many ways, yeah. But it does raise the question, do we always need autogenous bone for GBR?
Oh, okay. Now we're getting philosophical.
Right.
That's a good question.
And honestly, we need more research to answer that definitively. There's a lack of studies directly comparing those situations.
Okay.
For example, Ludden and colleagues, they did a systematic review on lateral ridge augmentation, which is a type of GBR, and they looked at cases with and without autogenous bone.
Interesting. So maybe in some cases we're using it when we don't need to.
That's the question, isn't it?
Yeah.
And that's what makes this field so fascinating. There's always more to learn.
Yeah, for sure. So let's just take a moment to recap what we've covered so far. We talked about why bone grafting is necessary, this whole horizontal bone loss thing, and then the different types of materials. And then we started getting into GBR and composite grafts, like that super graft you were talking about.
Right. That powerful combo of autogenous bone and bio-os.
Exactly. And then we kind of got into this philosophical debate about whether GBR is always needed and...
Yeah, and the role of autogenous bone.
Exactly. Now let's move on to some specific studies.
Yes. Let's see what the research says.
Yeah.
You sent in some really interesting research on long-term outcomes. One study that stood out was a 10-year follow-up.
Oh, wow.
By Chapu and colleagues.
10 years.
I know. They looked at that 2-layer composite graft, the autogenous bone and bio-os.
Right.
Using a type 2 placement protocol.
Okay.
Meaning the implant is placed a few weeks after the tooth is extracted.
Wow, 10 years is a long time to follow patients.
It is. And the results were really impressive. They saw a significant increase in the thickness of the facial bone wall after 10 years.
Wow. So they were able to actually reverse those effects of the horizontal bone loss?
Exactly. They were rebuilding that lost width.
That's incredible.
And creating a strong foundation for the implant.
That's so cool.
But here's the thing. The initial thickness of the facial bone wall
Okay.
didn't seem to matter.
Really?
Whether patients started with a lot of bone or very little, the graft was still effective in increasing the thickness over time.
So it was able to compensate even for like significant bone loss.
Yeah, which is pretty amazing. It really highlights the potential of this approach.
That's really encouraging.
Yeah, and they found another interesting correlation.
Okay.
The thickness of the soft tissue around the implant.
Oh, interesting.
The thicker the soft tissue, the better the bone grafting results tended to be.
So it's not just about the bone itself, it's about the surrounding environment as well.
Exactly. Healthy soft tissue is key for healing.
That makes sense.
Now let's switch gears to an animal study
Okay.
with 8 mongrel dogs.
Okay.
Don't worry, all ethical guidelines were followed. This study also used the type 2 placement protocol
Okay.
and compared different graft combinations.
Right.
It gets a bit technical.
Okay.
But the key takeaway was that autogenous bone, while it gradually disappears over time, it still significantly enhances bone formation.
Wait, the autogenous bone disappears? I thought that was like the gold standard.
It is, and here's why.
Okay.
Even though it's eventually resorbed
Okay.
and replaced by new bone, it acts like a powerful Kickstarter.
So it's kind of like setting the stage.
Exactly.
And it steps back.
It releases growth factors.
Right.
I see.
And attracts all the cells needed for bone building.
Got it. That makes sense. So it does its job and then it bows out,
Yeah. I like that.
gracefully exits. And this study also showed how important the membrane is in GBR.
Oh, right.
It acts as a barrier to prevent soft tissue from interfering
Okay.
and guides the growth of new bone.
So the membrane is like the unsung hero.
Kinda, yeah, working behind the scenes
I like that.
to make it all happen.
Okay, so let's talk about membrane selection.
Okay.
And harvesting techniques.
All right, let's get practical.
Yeah. What are the things to consider when you're choosing a membrane for GBR?
Well, a lot depends on the specific clinical situation.
Okay.
You know, the type of bone defect. Is it a 2-wall defect or 1-wall defect?
Right.
Horizontal versus vertical augmentation.
Okay.
All these factors influence the choice of material, thickness, and whether it needs any reinforcement.
So it's about picking the right tool for the job.
Exactly. Sometimes a simple collagen membrane is enough. Other times you might need a more robust PTFE membrane.
Okay.
And then there's resorbable versus non-resorbable.
Right.
Does it dissolve over time, or does it need to be surgically removed later?
I see. So there are a lot of different factors to consider.
Yeah, there are definitely trade-offs.
Okay.
Now let's talk harvesting.
Okay.
Where do we actually get this autogenous bone from?
Yeah, where does it come from?
We mentioned the chin, the back of the jaw. Your materials also talk about the zygomatic buttress
Okay.
and the anterior nasal spine.
Hold on, the nose. You're taking bone from the nose.
In some cases, yes.
Wow.
These areas offer good access and minimal anatomical alteration.
Okay.
But of course, the surgeon needs to be very careful.
Of course.
Avoid damaging nerves, blood vessels.
Right.
You might use a bone scraper, a bone mill, or even piezo surgery, which uses ultrasonic vibrations
Wow.
for really precise bone cutting.
It's incredible what they can do.
It is.
So many different techniques. Okay, let's talk about sinus lifts.
All right, this is a big one.
Yeah, sinus lifts sound kind of intense.
They can be. So imagine the maxillary sinus, that big air-filled cavity above your upper teeth.
Okay, yeah.
A sinus lift raises the floor of that sinus to make room for implants.
So you're literally lifting up the sinus membrane to create space.
Exactly.
Wow.
And there are different ways to do this.
Okay.
One common approach is the lateral window sinus graft,
Okay.
where they access the sinus through the side wall of the maxilla.
So they're creating a window in the bone.
Yeah, a small window to get inside.
That sounds pretty delicate.
It is. It requires a skilled surgeon.
Yeah.
Another approach is the internal sinus lift,
Okay.
also called the Summers lift.
Okay.
Here, they lift the sinus floor from the inside using special instruments.
So no window in the bone.
Exactly. It's less invasive in that way.
Wow. That's really impressive.
So the choice of technique really depends on the specifics of the case.
Makes sense.
Now, what do they put in that space once they've lifted the sinus?
Yeah, what's the actual material?
Bio-os is a popular choice.
Oh, okay.
Now, remember that bovine bone we talked about?
Right, yeah.
Alvera and colleagues did a 9-year study
Oh.
showing a 100% survival rate for implants placed in sinuses augmented with bio-os.
That's amazing.
Autogenous bone is also an option.
Okay.
Some believe it leads to better bone formation, but there's debate about whether it's truly superior to bovine bone.
So again, multiple options, pros and cons.
Yeah, exactly. Choosing the right material is a complex decision.
Right.
It's about the patient's needs, the surgeon's experience, and the scientific evidence.
Got it.
Now, we should also talk about potential complications.
Right. Let's talk about what could go wrong.
No surgery is risk-free,
Of course.
and sinus lifts are no exception.
So let's hear it.
A common intraoperative complication is perforation of the sinus membrane.
Okay.
It happens in about 10% of cases,
10%.
but it can usually be managed without compromising the outcome.
Okay, that's good to know.
Bleeding is also a possibility.
Right.
There's always a risk of bleeding with surgery,
Makes sense.
and there's a small risk of nerve damage or even implant displacement into the sinus, though that's rare.
Okay, those sound pretty serious.
They are, but thankfully uncommon.
Okay, what about long-term risks?
Long-term complications are less common.
Okay.
They could include things like implant loss
Right.
or sinusitis, inflammation of the sinus.
Okay.
But overall, implant survival rates after sinus augmentation are very good.
That's good.
A review of 85 studies found an average survival rate of 94.2%.
Wow, that's reassuring.
Yeah, it's important to keep things in perspective.
So there are risks, but the chances of success are pretty high,
Absolutely.
especially when you consider the alternative might be not having implants at all.
Exactly. Weigh the risks and benefits.
Right.
Have a conversation with your dentist
Yep.
and make an informed decision.
Good advice. So let's recap this section. We talked about those long-term studies.
Yeah, the two-layer composite graft, the importance of bone and soft tissue.
Exactly. And then the different types of membranes and the harvesting techniques.
And of course, sinus lifts.
All the different approaches and materials.
And the potential complications.
Right. So in the final part of our deep dive,
Yes.
we're going to wrap things up.
Okay.
Give you some key takeaways
This is good.
and some thought-provoking questions.
I like it.
Wow, we've covered so much.
Yeah, it's a lot to take in.
It really is.
But I think it shows just how many options there are out there.
Right.
And how far we've come in terms of bone grafting.
Definitely. So after all of this, like, what are the key takeaways?
Okay.
What should our listeners be thinking about if they're considering this procedure?
Well, the biggest takeaway for me is that there's no one-size-fits-all.
Right.
Bone grafting is a very personalized procedure.
Okay.
The best approach really depends on a lot of factors.
Like what?
The type of bone defect,
Okay.
location in the mouth, the patient's overall health,
Right.
even their preferences.
So it's not just like, oh, I need bone, pick a graft, let's go.
Right. It's more nuanced than that.
Yeah.
There's a lot of planning involved.
Okay.
And that's why it's so important to consult with an experienced dentist or oral surgeon.
Right. Somebody who can really assess the situation
Exactly.
and guide you through the process.
Yeah, they can explain all the options, help you make an informed decision.
That makes sense. So knowledge is power, right?
Absolutely.
Now our listener has all this information.
Right.
They can go into that consultation feeling prepared.
Yeah. Ask the right questions. Be an active participant.
Exactly. I love that. So as they continue doing their own research,
Yeah.
what should they be focusing on?
Look for evidence-based practices.
Okay.
Talk to reputable professionals.
Right. There's a lot of info out there.
Yeah, it can be overwhelming.
It really can. So you have to be careful.
Definitely. Be a critical thinker, especially when it comes to your health.
That's great advice. So with everything we've learned today,
Yeah.
here's a final question for our listener to ponder.
Okay, let's hear it.
What factors would you prioritize when choosing a bone grafting approach?
Ooh, that's a good one. Lots to think about there.
Yeah. Well, to our amazing listener, thanks for joining us on this deep dive.
Yeah, thanks for listening.
We hope you found it helpful.
And we wish you all the best on your journey to a healthy and beautiful smile.
See you next time.